Good evening, Black people and all allies fighting for Black liberation, Black prosperity, and Black joy. I'm Charles Blow, and welcome to Prime. Coronavirus cases spurred by the Omicron variant are reaching new heights day after day. Yesterday, the country reported a record-shattering 1 million COVID cases in a single day, according to data by Johns Hopkins University. That's more than double the record set by the U.S. just 4 days prior. The country also smashed the world record for single-day infections, doubling India's previous record set in May, Bloomberg reported. According to the Department of Health and Human Services, a quarter of the country's ICUs are at the brink of capacity, largely treating unvaccinated patients. The chaos of the surge has also descended on schools amid outbreaks amongst teachers and other staffers and students. School districts in Cleveland, Detroit, and Newark and Atlanta are the latest to postpone reopening after holidays or move to remote learning for days, if not weeks. The fate of tomorrow's classes in Chicago hang in the balance of a vote by the city's teachers union, which may refuse to show up to schools out of safety concerns. In New York City, the country's largest school district, classes resumed as planned this week. The city's new mayor told parents to fear not, vowing New York's enhanced testing program will keep families safe.
Strand after strand, we can't continue to stop our children from developing socially and academically and the support that they need. So we have to learn how to live with COVID and live with COVID with a safe way.
In Florida, where cases are surging more than any other state, the governor announced schools will also stay open for in-person learning. And the state's Surgeon General said Florida would shift away from the Biden administration's emphasis on testing.
We're going to be working to unwind the sort of testing psychology that our federal leadership has managed to, unfortunately, get most of the country in over the last 2 years. It's really time for people to be living, to to make the decisions they want regarding vaccination.
Across the Black Belt, COVID cases have continued to soar and dominate hospitals in Georgia, where the state is edging closer to the peak of hospitalizations during the Delta variant wave. Joining me now to discuss is Dr. Oni Blackstock, founder and executive director of Health Justice. Dr. Blackstock, what do you make first of the Surgeon General of Florida saying that they're going to shift away from the testing that the Biden administration basically had forced it onto the states?
Good evening. Thanks so much for having me on. I was, quite shocked at what Dr. Ladapo had to say. I think it didn't make a whole lot of sense and wasn't backed by science. Particularly, he's standing at a podium that says early treatment saves lives. He's referring to the monoclonal antibody treatments. But in order to be able to benefit from those, you need to be able to test and test positive, right? And so if we're saying that testing is not an important part of our pandemic response, how can we utilize these treatments that have been very helpful for folks who are at high risk for severe COVID? So, in Florida, the state of Florida, they've shifted away from really helping or supporting vaccinations. There are no mask mandates, and now they're moving away from testing. So none of it really makes a whole lot of sense.
Let's talk a little bit more about testing, because we don't have enough testing right now. That is a failure that I think everybody has acknowledged there's a failure. But if you have a limited supply, is it reasonable for at least some people who are asymptomatic, do not believe that they have had a direct exposure to someone who is COVID positive, to maybe not test as often so that people who are experiencing symptoms may be able to get tested?
Mm-hmm. Well, I just want to say that I think the scarcity of tests is a manufactured scarcity. The federal government can do a lot more to ensure that we have ample supply of tests, as we see in other countries where people are able to have tests sent to them where they can test daily. And so I don't think that we should have to be in that situation where we are rationing tests and figuring out, who is best able to benefit from testing. So I think it's sort of a false choice, and we need to really put pressure on the federal government to use the Defense Production Act and get those tests out there. Biden promised 500 million at-home rapid tests. There's going to be a website that they set up later this month, but we need those things. We need that now. And actually, there was a report that came out that I think back in October, actually, the Biden administration was thinking about, what they could do to get Americans rapid tests in large volumes, and they actually walked away from that plan. So this is a result of poor planning, poor priorities, and really a vaccine-centric pandemic response by the White House.
Right, yeah, it's poor, but we're in it right now. Let's shift away from what the federal government can do on testing to what they can do on treatment. The Biden administration had ordered enough antiviral pills for 20 million Americans, but only 35,000 were ready this month. Some experts predict that this wave will peak this month. Are these antiviral pills going to arrive too late for this round of the virus?
Right. So this extra 10 million that was being ordered in terms of these antiviral pills from Pfizer, we're going to see sort of larger amounts of it available in a few months when we actually need that medication now. So sort of similar to the promise of the 500 million at-home rapid tests that Americans can order that aren't here yet when we need them. Again, the antiviral pill by Pfizer is not yet available, and it's really unfortunate that people are not able to take advantage of what is a really effective and potent medication.
The way this wave is hitting schools has been really distressing for a lot of people, but a lot of that has been focused on primary school, grade school, high school. Let's talk a little bit about colleges. Clark, Morehouse, and Spelman took stricter COVID precautions this past semester than other schools in Georgia and have indicated they'll probably keep the same measures in place for the coming term. Teachers and students must be vaccinated unless they have an exception, and masks are required for most indoor and outdoor events. What is the right path for schools, particularly colleges where you have young adults?
Yeah, I think that's really encouraging to hear that there are some universities that are doing what they need to do in terms of mitigation measures, in terms of masking, vaccination requirements. And, I don't know if they're offering testing as well, but if they're doing that, those are all the things that we need to do in order to make sure that not just students are safe, but professors, university staff. So I think we can have, business as usual, but we need to make sure that the appropriate mitigation measures are in place to really keep people safe and reduce the risk of students, professors, and staff being exposed to COVID. So it sounds like the Atlanta universities are doing really great, and there may be other universities that may want to actually follow their lead, because we know that, within these congregate settings where students are living together, that this is fertile ground for outbreaks, which we have seen.
So let's stay on the schools for a little bit. I want to play you a package that we prepared here. Just get your response to it on the other side.
Mm-hmm. In large urban cities like Philadelphia, Atlanta, and Cleveland, remote learning is back, and Chicago could be next, just to name a few. The problem is, when the pandemic first hit in 2020, some of the same cities struggled with closing the digital divide. Many black and brown students lacked access to the internet. 2 years later, the problem still exists.
Photos of kids doing their homework, sitting in the parking lot, not in a car, but sitting right in the Taco Bell parking lot, that hit a lot of folks.
Angela Seifer is executive director of the National Digital Inclusion Alliance.
If we want folks to be able to have a full education, if we are going to ask them to learn from home, we have to address the fact that they need access to the internet that's affordable and reliable.
Internet service providers have offered free or low-cost options to parents in low-income communities, but the divide still exists. Seifer says to close the gap, it will take a long-term comprehensive collaboration between the public and private sectors, with the aim of helping poor black and brown and rural communities get caught up technologically. For now, the remote learning model is a short-term Band-Aid approach.
The digital divide existed prior to COVID, and it's not going away.
So doctor, this is a double-edged sword for black and brown kids, right? So if they're kind of more exposed to the virus itself and getting sick if they were to go to school, but if they stay home, there are also big challenges for them. They may not be able to learn at the same pace as their peers. They may be missing meals that they were counting on, their families are counting on. Their parents may not have jobs that allow them to take off to homeschool them. What is the tension and what is the right kind of way to look at this as a society when we're talking about kids who have less or fewer resources?
Right. Yeah. No, this is such a challenging situation and really about balancing, benefits and risks. And I think it's, incredibly important. For instance, I'm here in New York City where Mayor Adams has said, schools are going to remain open. And I think that's fine, but we have to ensure the appropriate safeguards are in place. And so if we don't have, enough testing, for instance, for students, and we don't have, teachers wearing high-grade masks or access to high-grade masks, if we don't have the appropriate ventilation and air filtration, then that's not a safe situation for anybody. And so I think, if we're going to keep the schools open, let's do what we need to do to keep our children safe. And so we saw that actually with a number of school districts. I think in DC, for instance, they required, for instance, a negative test for students and staff who are returning to in-person school. So there are things that I think a number of districts are doing, and I think that's why a number of districts actually postponed opening, is because they want to institute some of these different safeguards, getting masks and N95s out to teachers, getting testing available, all of that. So if we can do that for our children and create a safe space for them, fine, let's keep the schools open. But if we cannot do that, then the alternative will be them being at home, unfortunately. And we know that obviously there are challenges with learning and socio-emotional development, but that may be the better alternative.
Right. Dr. Oni Blackstock, thank you so much for your time today. I really appreciate it.